Good morning, everyone. Hello, welcome to the Health Breakdown. Let's talk about something many people over 60 experience, but rarely get clear answers about: dizziness and unsteadiness. Maybe you've noticed it yourself, standing up too quickly and feeling lightheaded, or walking across the room and suddenly feeling unsure of your balance. You might have even chalked it up to just getting older. But what's really going on? Today, I want to shed light on the real reason you may feel dizzy or unsteady after 60, and more importantly, what you can do about it. Let's start with a myth buster. Feeling dizzy is not just normal aging. It's common, yes, but it's not inevitable, and it's not something you should just accept. Dizziness and balance issues are your body's way of telling you something needs attention. As we age, many subtle changes occur in the body that affect how we move, react, and maintain our physical stability. One of the most significant changes happens in the balance system, particularly in the vestibular system located in the inner ear. This system plays a crucial role in helping us stay upright, oriented in space, and aware of motion. It does so by sending constant signals to the brain about the position and movement of the head. However, as we reach our 60s and beyond, this system begins to decline, often without us realizing it, until we start feeling dizzy or unsteady. The vestibular system relies on tiny structures inside the inner ear, specifically hair cells that detect motion and spatial orientation. These hair cells are incredibly sensitive and help translate movements into signals that the brain can interpret. With age, these cells diminish in both number and function. As a result, the inner ear sends weaker or less accurate signals to the brain. The brain, in turn, has a harder time understanding where the body is in space, which can lead to sensations of spinning, tilting, or simply feeling off balance. This natural decline can be gradual, which is why many people don't notice it immediately. One day, standing up from a chair may feel fine, and the next, it might result in a wave of dizziness or a brief loss of stability. These changes can be disorienting, and many people brush them off as just getting older, without understanding the underlying mechanisms at play. Compounding the issue, our brains also become less efficient at processing sensory information as we age. So not only are the inner ear signals weaker, but the brain may also take longer to react to them. When the brain can't quickly coordinate messages from the vestibular system, vision, and muscles, balance suffers. This miscommunication makes older adults more prone to losing their footing, especially in unfamiliar or dark environments. Another consequence of vestibular decline is that older adults may begin to avoid movement altogether for fear of falling. Ironically, this can worsen the problem. Less movement means less stimulation for the balance system, leading to further deterioration. The vestibular system, like any other system in the body, benefits from regular use. Activities that challenge balance, like walking, stretching, or practicing gentle exercises, can help keep it more responsive and functional. In summary, aging naturally affects the balance system, particularly the delicate mechanisms within the inner ear. While this decline is common, it is not irreversible. Understanding how the vestibular system changes with age empowers older adults to take proactive steps through exercise, regular checkups, and mindful movement to maintain better balance and reduce the risk of falls and dizziness. Recognizing this issue early and addressing it can make a major difference in maintaining independence and quality of life in later years. Maintaining balance is a complex process that relies on the integration of several body systems working together seamlessly. It's not just one organ or function that keeps us upright and steady. It's a coordinated effort between the eyes, ears, muscles, joints, and brain. As we age, each of these systems can experience a decline in performance, and even small changes in one area can disrupt the entire balance mechanism. This is why many people over the age of 60 begin to notice a sense of unsteadiness or increased dizziness, especially during routine activities. The visual system plays a crucial role in helping us stay balanced. Our eyes constantly send information to the brain about the environment around us, how far away objects are, where the floor is, and what direction we're moving. When vision begins to deteriorate due to age-related conditions such as cataracts, macular degeneration, or glaucoma, the brain receives less accurate or delayed visual input. This can make it harder to judge distances or perceive obstacles, increasing the risk of tripping or missteps that lead to falls. The musculoskeletal system is another key player. Our muscles, bones, and joints provide the physical strength and stability needed to maintain posture and correct our position when we begin to lose balance. Over time, muscle mass and strength naturally decline in a process known as sarcopenia. Joints can become stiffer, and conditions like arthritis can limit mobility. When our muscles aren't strong enough to make quick adjustments, or our joints don't move as fluidly, the body struggles to react to shifts in position or external forces. The somatosensory system, which includes receptors in the skin, muscles, and joints, also plays a vital role. These receptors send signals to the brain about the position and movement of different parts of the body. For example, they help us know where our feet are even when we're not looking at them. With age, nerve conduction can slow, and in some cases, neuropathy can develop, especially in individuals with conditions like diabetes. This reduced sensory feedback makes it harder for the brain to accurately assess how the body is positioned, which can lead to instability. All of this sensory input must be interpreted and integrated by the brain. The brain acts as the command center, quickly processing information from the eyes, ears, and body to make split-second decisions that help maintain balance. Unfortunately, the brain's processing speed can decline with age, and cognitive impairments such as mild cognitive decline or dementia can further interfere with this process. When even one part of this intricate system begins to falter, the whole system is affected. This is why dizziness or balance issues often can't be traced to a single cause. It's usually the result of multiple subtle changes across different systems. Recognizing that balance is a whole body function helps in creating effective prevention strategies, such as comprehensive exercise routines, regular eye exams, physical therapy, and targeted strength training to support overall stability and reduce the risk of falls. One of the most commonly overlooked causes of dizziness and unsteadiness in older adults is the effect of medications and changes in blood pressure. As people age, they are more likely to be prescribed multiple medications for managing chronic conditions such as high blood pressure, diabetes, heart disease, anxiety, or depression. While these medications are often necessary and beneficial, they can have side effects that impact balance and cause dizziness, especially when used in combination. A major issue is that the body's ability to metabolize and eliminate medications slows down with age. The liver and kidneys, which are responsible for processing and excreting drugs, become less efficient over time. This can lead to medications building up in the body, increasing their effects and side effects. Dizziness, drowsiness, and confusion are among the most common side effects of many commonly prescribed medications for older adults. These effects can make someone feel unsteady on their feet or even lead to falls. Some of the most frequent culprits are medications used to treat high blood pressure. While controlling blood pressure is crucial for preventing strokes and heart attacks, these medications can sometimes lower blood pressure too much, especially when changing positions quickly, such as going from sitting to standing. This sudden drop in blood pressure, known as orthostatic hypotension, can cause a brief but intense feeling of lightheadedness or faintness. This sensation often lasts only a few seconds, but it's long enough to result in a loss of balance or even a fall. Diuretics, another type of blood pressure medication, increase urination and can lead to dehydration if fluid intake isn't sufficient. Dehydration itself is a common and preventable cause of dizziness, especially in older adults who may have a reduced sense of thirst. Additionally, medications for depression or anxiety, Particularly sedatives or tranquilizers like benzodiazepines can depress the central nervous system, slow reaction times, and dull balance reflexes. This puts individuals at greater risk when they need to make quick adjustments to stay upright. Another concern is polypharmacy, the use of multiple medications at the same time. Interactions between drugs can amplify side effects or create new ones that wouldn't occur with just a single medication. For instance, combining a blood pressure medication with a sleep aid or an antidepressant may significantly increase the risk of feeling dizzy or mentally foggy during the day. Because of these risks, it's crucial for older adults and their caregivers to regularly review medications with a healthcare provider. Adjusting dosages, changing the timing of medication, or finding alternative drugs with fewer side effects can greatly reduce dizziness and improve balance. In some cases, non-drug treatments such as physical therapy, dietary changes, or mindfulness techniques can also help manage the conditions for which medications were originally prescribed, potentially reducing the number of medications needed. By recognizing the strong link between medications, blood pressure changes, and balance problems, older adults can take informed steps to reduce dizziness, avoid falls, and maintain a higher quality of life. One of the most common but often misunderstood causes of dizziness in older adults is a condition known as benign paroxysmal positional vertigo, or BPPV. While the name may sound complicated, the experience is surprisingly common. Sudden, brief episodes of spinning or dizziness triggered by changes in head position. These episodes can be alarming and disorienting, especially when they strike unexpectedly, such as when turning over in bed, looking up, or bending down. BPPV is caused by a mechanical problem in the inner ear. Deep inside each ear is a small organ called the vestibular labyrinth, which includes structures that help detect head motion and orientation. Inside part of this labyrinth are tiny crystals of calcium carbonate called otoconia. These crystals normally sit in a specific area where they assist in sensing gravity and linear movement. However, in BPPV, these crystals become dislodged and migrate into one of the semicircular canals, fluid-filled tubes that help detect rotational movement. When the head changes position, these loose crystals disturb the flow of fluid in the canal, sending false signals to the brain that create the sensation of spinning or vertigo. This can cause brief but intense bouts of dizziness that typically last less than a minute. Although BPPV is not life-threatening, the unpredictability and severity of these episodes can significantly interfere with daily life, increasing the risk of falls and injuries. BPPV becomes more common with age. The exact reason why the crystals become dislodged isn't always known, but age-related degeneration of the inner ear structures is a significant factor. In many cases, BPPV develops without any clear cause, though it can also follow a head injury, ear infection, or prolonged bed rest. One of the reasons BPPV is often overlooked or misdiagnosed is because its symptoms can mimic those of other conditions. People may describe it as general dizziness, lightheadedness, or a feeling of being off balance, which can lead doctors to look at cardiovascular or neurological causes first. However, once BPPV is correctly identified, it can often be treated effectively with simple physical maneuvers that guide the displaced crystals back to their correct position. The most well-known of these treatments is the Epley maneuver, a sequence of specific head and body movements performed to reposition the crystals. Many people experience immediate or rapid relief after a session, and in some cases, BPPV resolves on its own. However, it's not uncommon for symptoms to recur, which is why learning these maneuvers or having access to a trained provider is helpful. Importantly, BPPV does not respond to medication, which is why correct diagnosis is essential. Anti-vertigo drugs may dull the symptoms but don't address the underlying issue. Older adults who frequently feel dizzy, especially with head movements, should ask their healthcare provider about BPPV. By identifying and treating this common inner ear condition, many individuals can greatly reduce dizziness and regain confidence in their balance and mobility. Lifestyle and health habits play a vital role in maintaining balance and preventing dizziness, especially as we grow older. While many people believe that unsteadiness and vertigo are unavoidable parts of aging, in reality, everyday choices related to hydration, nutrition, physical activity, and self-care can have a major impact on how stable and energetic we feel. By understanding how these habits influence the body, we can take meaningful steps to improve balance, reduce fall risk, and maintain a higher quality of life. One of the most overlooked contributors to dizziness is dehydration. As we age, our sense of thirst diminishes, which means older adults may not realize when they're not drinking enough fluids. Dehydration lowers blood volume and reduces blood pressure, which can cause lightheadedness, especially when standing up quickly. Even mild dehydration can affect brain function and physical coordination. That's why it's essential for older adults to drink water consistently throughout the day, even if they don't feel thirsty. Nutrition is another key factor. The body relies on a range of vitamins and minerals to support muscle function, nerve signaling, and brain activity, all of which are essential for good balance. Deficiencies in nutrients like vitamin B12, magnesium, potassium, and vitamin D can lead to symptoms such as fatigue, muscle weakness, and even neuropathy, which contributes to poor balance. A diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats helps fuel the body and brain and supports stronger, more coordinated movement. In addition to proper hydration and nutrition, regular physical activity is one of the most powerful tools for preventing dizziness and unsteadiness. As we age, our muscles naturally lose strength, and our reaction times slow down. This makes it harder to catch ourselves when we stumble or lose footing. However, engaging in exercises that build strength, improve flexibility, and enhance coordination can dramatically reduce the risk of falls. Activities like walking, swimming, tai chi, yoga, and balance-focused workouts not only improve muscle tone and joint flexibility, but also train the brain and body to work together more efficiently. Sleep and stress management also contribute more to balance than many people realize. Poor sleep can impair brain function, slow reflexes, and affect spatial awareness. Chronic stress and anxiety can cause tension in the body and dizziness related to hyperventilation or increased heart rate. Incorporating calming routines like deep breathing, meditation, or gentle stretching into daily life can help reduce these symptoms. Finally, regular health checkups are essential. Monitoring blood pressure, reviewing medications with a healthcare provider, checking vision and hearing, and treating any underlying conditions early can prevent many common causes of dizziness and instability. Preventive care combined with healthy habits creates a strong foundation for better balance. In summary, dizziness and unsteadiness are not just about aging. They are often a reflection of how well we care for our bodies on a daily basis. With intentional choices around hydration, nutrition, movement, and self-care, many older adults can feel steadier, more confident, and more in control of their overall health.